terms of oversight and regulation, is New Jersey keeping up, do you think?
I think we're keeping up, but we've got to be on constant alert, because this system, between the changes because of Obamacare, the changes in the hospital consolidations in New Jersey, the whole thing is changing rapidly. And we've got to concentrate on the individual. You shouldn't have to have every device, every expensive machine at every hospital. You should be able to have, if you've got a particular disease, maybe you have to go 45 minutes to get the best treatment. But that's where you get the best treatment. The next hospital down the street may be expert on something else. But if you spread out the expertise so that everybody's not trying to do everything, you're going to have better hospitals and we're going to get better health care.
Well, given that, Governor, in terms of public policy, what can or should the executive and legislative branches of government be doing?
Well, they regulate the hospitals, first of all, to make sure they are charging properly and to make sure they are doing the right thing and to make sure New Jersey patients are covered. And we've got a number of great hospitals in the state now. Some of them consolidated. Some of the urban hospitals have now acquired some rural hospitals, and the whole chain ought to provide reasonable health care for the state of New Jersey, but not without supervision. Hospitals, like anything else, government has its place, and government's place is to regulate it for the consumer, for you and I.
Well, let me ask you this. As the former chair of the Robert Wood Johnson Foundation, which is also a sponsor of this program, there is, by the foundation, an effort being spearheaded to get local communities more involved in better healthcare services for individuals and for families. Given the changing times here in New Jersey especially, how important is that effort, do you think?
That is absolutely vital, because a lot of the healthcare expenses now, and we know that because of childhood obesity, that because we don't take care of ourselves, because we allow ourselves to run down and therefore get diseases. And in a community, if you're sponsoring what's called preventive health care, if they're teaching you and I not to smoke, to get a little exercise every day, to lose a little weight if we're too heavy as a child or as a young person, we're not going to get so sick. And the whole cost of the health care is going to go down, and we're going to be healthier to boot. So that's done in the community. So the Robert Wood Johnson program is exactly right, and hopefully I get hold of people, and we're going to do some of the things we should and don't often do enough, and maybe you'll be healthier because of it.
While there's still a lot of controversy going on in Washington over the Affordable Health Care Act, there are studies that show here in New Jersey that the number of uninsured people has been significantly reduced. What is your opinion of Obamacare and how it's worked here in New Jersey?
Well, look, it's a step forward, Obamacare, no question about it. People are getting covered who want to be covered before. So for the poor and the uncovered, it's particularly a good program. But it needs a lot of change. They didn't do anything about the cost. We're still getting a cost that's running at rates that we're not going to be able to afford in the next 10 years if it stays at these rates. So it's got to be amended and it's got to be changed. Instead, we got a Democratic Party in Washington who said Obamacare is terrific, don't touch it. The Republican Party says it's all bad and we got to get rid of it. The answer is in the middle. We should take what's good about Obamacare, keep that, and amend the rest of it. So it's more like some of the other systems in other parts of the world that can also save costs at the same time as preserving health care. Washington's got to compromise. They've got to learn that.
Can that be done? Can that be achieved, given what's going on in Washington today?
There are people down there. They ought to be able to compromise with other people. A lot of those people, they're friends of mine down there in both parties. I know they're good people. There's no reason they shouldn't be talking to each other. And it's healthcare is just one of the areas where we're suffering badly as a country and as a people, because people can't simply talk to each other and from across the aisle. I hope the next president will work with the Congress and fix Obamacare. So it's a much better system than it is now. So it takes care of people, also keeps costs down, and makes sure, again, we're the healthiest nation in the world. We're not now, and we should be because we're spending enough to be.
Governor Kean, thank you very much for sharing your views on this issue.
Thank you.